Dr. Ali, in the hunt for treatment, so much attention has been put on hydroxychloroquine. President Trump has touted it as a possible miracle drug in the fight. Tens of thousands of doses have been sent to several states, but there are potential risks. What are you seeing? What are you hearing?
Well, I'm seeing things on the ground which are very concerning when it comes to the coronavirus and its effect on the heart. So we always talk about the lungs and inflammatory responses in the lungs, but it's also having some inflammatory responses in the heart. Now, hydroxychloroquine has been around, but whenever it's prescribed, the physician always checks a baseline EKG and they look at other medications which could interact with it, because hydroxychloroquine has an adverse effect on the heart's ability to regulate its rhythm, its heartbeat, and you can get a higher risk of irregular heart rhythms, and that can be very dangerous, especially people sick with coronavirus, because now we are learning that the virus itself can also affect the heart and the heart rhythm as well. So if we're in a hospital or you're under the guidance of a physician who can monitor you, it can be relatively safe. But if everybody starts taking the medications without having close monitoring, there could be some dangerous side effects and stuff that we're still learning more about because of all the new data we're getting about how the virus can actually affect the heart itself.
Dr. New York, Michigan, Louisiana, all hotspots, but there are concerns this morning and focus on new hotspots like Texas. What do you know?
Well, what we're seeing the trends showing that we are getting more results from Philadelphia and the metropolitan area surrounding Philadelphia, so Camden, New Jersey, Washington, D.C., for example, and they're showing the pattern that shows that they are approximately 2 weeks behind New York.
We know nursing homes have been a vulnerable spot here when it comes to this pandemic. When we talk about the flattening of the curve in those hotspots, there is still real concern growing about nursing homes. People wondering, should they move their parents, their grandmother, or grandfather from these facilities? What are you seeing?
Well, Kenneth, this is really close to me because I'm a geriatrician and I work in nursing homes. And I've seen the lapses in infection control for many, many years now. Long before this pandemic, we had flu, rhinovirus, metapneumovirus, respiratory illnesses were rampant. It's all about staffing. It's hard to maintain infection control when you have such a low staff to patient ratio. And, you know, the Kaiser Foundation did a study showing that 9,000 nursing homes across the United States failed inspections, and many of them failed them multiple times. And it's time now that we really pay attention to this lapse in infection control. So unless you can really ascertain if a nursing home is doing a good job of separating its COVID-positive patients from its COVID-negative patients, either in a separate facility or in a separate wing, you know, I'm going to have to agree with the Los Angeles Public Health County Director that maybe you should take your relatively independent loved one out of the nursing home for the time being until we get through the critical phases of this pandemic.
That is quite a statement from Dr. Ali there, and tough decisions for families to have to make, whether or not to pull a loved one out of a nursing facility, knowing that they might not have the space, the ability to take care of that elderly loved one properly as well. So many tough decisions for so many families.
Or potentially fear that you're going to be the one that put them at risk. Another interesting point that he made is that the D.C. area, Philly, is 2 weeks behind. So this is far from over. Even if it's over in New York, there's going to be a new epicenter, more hotspots.
Do not get complacent.